Ladies and gentlemen, good evening and welcome to the #1 show that provides you with the news and views of all things medical. Doctor in the House is back on the air for a new season. And what a great feeling it is to be back here once more at the IBN studio. It's always a pleasure and privilege to join you. And it's part of the open forum, so you feel free to phone in the latter part of the program with any of your questions, thoughts and ideas on medical topics. We have a bumper program in store for you. Just a reminder that we're live on Monday nights with a rerun on Saturday at 1 p.m. And you don't have to waste money paying for cable because we are also streaming live on the IBN website and a new feature too on YouTube, the IBN Master. So you go onto YouTube, you put in IBN Master, and you'd be getting Doctor in the House live and direct. Thank you for all of your wonderful calls, messages, and emails. It certainly provides us with the impetus and stimulus to do better. As usual, we'll start with a bit of the medical news, but before we do so, let's take a short break. Stay with us on the new season of Doctor in the House.
Prices on all grocery items. Trust low-cost supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high-quality meat cuts, and a warm and friendly service. Low-cost supermarket, Sun and Main Road, Cunupia.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
مولاي صل وسلم دائما 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 مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم محمد سيد الكونين والثقلين محمد سيد الكونين والثقلين محمد سيد الكونين والثقلين والفاري.
Welcome back to Doctor in the House. And as well, I should say that a special welcome back will be due to But Dr. Juman, who has been one of the mentors and the pioneer for this medical program, and he will be alternating with Dr. Omardeen and me. So onwards to the medical news. It has been 16 years since the horrific 9/11 attacks in the United States, and many persons are still suffering from post-traumatic stress. Involves issues with sleep and flashbacks, intrusive flashbacks, fears, nightmares, and affecting the quality of the person's life and those around them. And many physical problems following that horrific day on 9/11. 3,000 persons died on that fateful morning, including 14 trainees, with 6,000 persons hurt on one of the darkest, deplorable stains in the world's recent history. Congratulations to all of the successful students in the recent CSEC and CAPE examinations, and may God bless all in this new school year, new academic year. So inclusive of my niece who started her preschool, her first time at school at the age of 3. And of course, traffic jamming still, as we remember, when school starts back, the traffic woes begin. And there was a recent report saying that when you think about it, there are many years of productivity, and you think about the mental and physical stress on the body that can sometimes occur when you're locked in a traffic jam. It's something I do know successive regimes have been trying to deal with limited success. TUTA, which is the union involving the teachers, it's the governing body for the union. TUTA has also been highlighting a lot of problems with neglected repairs in schools over the last week. But certainly we wish all of our students God's blessings in the new school term and the new year, the academic year. Much of the news in the mass media was based over the last week as Mother Nature struck back with cataclysmic storms and monster hurricanes, leaving a trail of destruction in the West Indies and the United States, with landslides, flash flooding, and giant waves. 35 hospitals in Florida, Georgia, and South Carolina had to be closed yesterday, and there were widespread evacuations in those countries. So in fact, I think in Florida, that officials there said that nearly 7 million persons had to leave their homes, causing a mass exodus of persons northward. Now, when we're thinking about hurricanes, and there are more that apparently are forming in the Atlantic, and it's linked to climate change. Hurricanes, like the monster hurricanes that we've been seeing over the last few days, create public health challenges. And this might include increased amounts of sewage, chemicals, and waterborne germs, which are mixed with water. So, and I know we have a clip as well, too, showing some of the horrific scenes arising out of hurricanes hitting Miami and parts of Florida. Concerns about infected wounds, drownings, electrocutions. There may be animals like snakes and rats in the water. Increased amounts of mold as a result of the high levels of moisture. Poisoning from fumes, carbon monoxide from generators, because that has been one of the major issues, a loss of power in places like Florida and the rest of the islands that were battered by Hurricane Irma, and a lack of hygiene in shelters. In the months and years to come, that same thing that I just spoke about, which arose from the 9/11 incident, mental health issues, post-traumatic stress, trying to rebuild after a hurricane, an island, small islands in the Caribbean like Barbuda, that has been rendered virtually uninhabitable. Places like St. Martin, I understand that it's a virtual war zone with crime-ridden areas. So wonderful, beautiful, tropical paradises have been laid to waste by these monster storms. Even Joel Osteen was under pressure. So after Harvey hit Houston, so all these names, and Hurricane Jose is forming in the Atlantic. Global warming and climate change is definitely impacting and leading to increased rainfall. The American Diabetes Association, from a medical standpoint, shipped 3,000 pounds of diabetes supplies to persons affected by Harvey. That was the hurricane so about a week or more ago that hit Houston, and some of those supplies included 200,000 needles, syringes, 50,000 pens, and 20,000 alcohol pads to monitor blood sugar levels. And it has been an issue too for some of the kidney patients who require dialysis. Some of the pregnant women are actually afraid that during the time of a hurricane, that the change in weather patterns, whether or not it can increase the chance for labor, or whether or not it's an old wives' tale, that change in the atmospheric pressure, that change when you're experiencing a hurricane and the eye of the storm, whether or not it's going to increase the likelihood of a rupture of membranes, premature rupture of membranes. So, but that was not really seen, and especially with the closure of hospitals, some of the pregnant women in Florida were concerned. Nature is striking back, and we in the West Indies should also remember during the rainy season and during the hurricane season that there are surges in dengue and leptospirosis cases. And we know that dengue is one of the viruses spread by the Aedes aegypti mosquito and marked by symptoms like fever, nausea, vomiting, abdominal pain, diarrhea, pain around the eyeballs, headache, and bleeding. And persons still die from dengue. Leptospirosis may be spread by infected rat or dog's urine, especially if especially if you have any cuts or sores and there's entry of the organism into the human body. And many persons have to be hospitalized. Sometimes it may affect organs like the liver and kidneys, and persons are ending up on dialysis. Zika, we know last year I spoke about Zika ad nauseum as there was a real surge in the latter part of 2016. Zika, so another one of the viruses spread by the Aedes aegypti, but there was a report last week that Zika may actually hold promise for the treatment of a special type of brain tumor called glioblastoma. And apparently that virus has been infecting and killing cancer cells preferentially, so they've been injecting it, still in the experimental phase, of course, but that's fascinating research. But whether or not we can utilize a virus that may cause misery and suffering and actually injecting it to assist persons with a special type of brain tumor. So now our neighbors in Venezuela have been crossing the border over the last few months to Guyana for treatment for malaria. So another one of the mosquito-borne illnesses that can be fatal if not diagnosed and managed appropriately. Revenge of Mother Nature. There's an earthquake as well too. There was an earthquake just last week in Mexico, quite a monster quake, registering more than 8 on the Richter scale. And so if you're thinking about all of the patterns and so on, and all of the changes in the atmosphere and climate of medical relevance, there was even a solar eclipse just a few weeks back, and persons are suing some of the manufacturers of glasses, including Amazon, because they have been saying that their eyes were damaged following the solar eclipse. There are special changes, and I know everyone was warned, although so many persons, including the President of the United States, insisted they wanted to take a quick glance with the naked eye. But persons were warned about the perils of looking at the solar eclipse with your eyes and not using proper eyewear because of possible permanent damage to the lining at the back of the eye or the retina. But some of the individuals are suing manufacturers of the glasses, saying that they used it, but their eyes were still damaged. So faulty glasses, which were recalled following the eclipse. And swarms of locusts locally have been affected. It's almost like a biblical plague in parts of Rio Claro. Some explanations for that, maybe global warming, climate change, and a failure for us, a failure on our part to look after our planet properly. And there are numerous medical issues, innumerable medical issues arriving from that. The scourge of crime has also been continuing over our little break. I know we took a few months off during the month of Ramadan and thereafter for the new season, but there have been daily murders with innumerable robberies. it seems like there's no respite for the hapless citizens in fighting this hydra-headed monster of crime. And at the same time, I'd also like to extend condolences to both the Broadbridge and Singh families after the recent murder of the matriarchs there. Stephen Broadbridge is a friend, and of course the Singh and Vishnu families from central Trinidad. We know them so well. Her sisters taught me at primary school. Her brother-in-law was one of my vice principals, and we certainly join you in the grieving on the loss of the matriarchs from the Singh and Broadbridge families. And we have been seeing a surge in crime, but it's been greeted as well too by the resignation of one of the senior pathologists at the Forensic Center in Port of Spain. And he has been a real lion in the struggle for resources at that center. Successive administrations have failed to improve the resources there. And hopefully there is some way. He said that he's getting on in age and this stress is too much for him. And hopefully there's some way that we can ensure that the services at the Forensic Center will not be disrupted following his departure. So over the last week, the public has also been saying that despite growing concerns and fears about crime, there's a loss of confidence in many of the authorities, and there's growing social problems reflected in pollsters in the daily media. Some of the news items too over the last day have mentioned about issues from Petrotrin and problems with the ferry to the Sister Isle over the past month. Maybe it's really high time for a bridge leading from Trinidad to Tobago. Luckily, and one of the good news items in the last week has been a 20% reduction in road fatalities for 2017 so far. So that's some good news. Remember, no drinking and driving. Use of your mobile phones are prohibited as well. And the speed limit remains at 80, so respect it. One of the ministers has been hospitalized. We certainly wish him well, and the Prime Minister is also expected back after going for health checks, while our Minister of Health has been calling for increased personal responsibility for persons seeking care at institutions nationwide. So we're just trying to encapsulate some of the news which we've missed out on over the last month. One of the vets has been speaking about an outbreak of a certain virus in South Trinidad, which is affecting dogs. So a reminder to dog owners to be vigilant that so far in South, there have been 40 deaths, so arising from dogs infected with this canine distemper virus. Look out for high fever, vomiting, diarrhea, weakness, and fluid from the eyes or nose. Moving further afield back into the United States, there was a new Surgeon General appointed there last week, Jerome Adams. So the Surgeon General in the United States, so it's analogous, I would think, to the Minister of Health in Trinidad. So he's in charge in terms of advising the president, the US president, and the lawmakers on certain aspects of healthcare. And he's eager to start helping victims of the hurricanes as the nation's doctor. His motto will be to create better health through better partnerships. So in an effort to address wide-ranging issues such as childhood obesity, mental health, and they have been having problems with addiction to certain drugs, the opioids like morphine and tramadol and codeine, that family of drugs that we know about here. And many persons are becoming addicted to drugs in that class, those painkiller drugs. So it's something that I think that we want to bring into the front burner in terms of medical care here. So you're watching the news, so you're listening to the news items on Doctor in a House, the new season. And staying in the United States, the Food and Drug Administration has warned about a drug that many kidney patients would know about. It's called sodium polystyrene sulfonate. The trade name is K-Exalate. So it's a powder which is usually mixed to bind to potassium. And it's a warning that don't take medications for about 3 hours before and after using these drugs, because it can hamper the absorption and the efficacy of the other drugs. So if you're taking that particular mixture, if you're using that powder to lower your level of potassium, because high levels of the potassium frequently seen in our kidney patients, and it may affect the rhythm of the heart. So if you're taking that particular drug, it was a reminder by the US Food and Drug Administration to separate that powder, separate that drug by about 3 hours from your rest of prescription medications. The American Stroke Association and American Heart Association recently published some recommendations on how to optimize brain health, how to avoid stroke, and 7 basic aspects of not just avoiding strokes, but I would think avoiding heart attacks, stopping smoking, regular physical exercise, about 30 to 60 minutes per day of walking, running, jogging, biking, whatever sort of physical activity that you fancy. It's important, I would think, too, that we start children. So one of the things the US Surgeon General, as I said, is going to tackle is childhood obesity. The chance for type 2 diabetes is quadrupled in children who are fatter than their peers. Keeping your body mass index below 25, so that's a ratio of your weight, but divided by your height squared. Maintaining a healthy diet, so one that is rich in fruits, vegetables, peas and beans, low fat, low salt, maybe fish if you eat it. Maintenance of this so-called Mediterranean diet. Keeping your blood pressure to below 120/80, so if you can, and keeping your total level of cholesterol below 200, and a fasting blood sugar level below 100. Those are some of the cardinal rules, then, if you wish, to maintenance of good brain health. And I think that that may well be extended to other parts of the body, inclusive of the heart and the arteries to the legs. Going across the Atlantic, Kate and Prince William, so from the royal family, expecting their 3rd child. And Kate has been laid low by morning sickness, which has affected her in her 2 previous pregnancies. Morning sickness can be particularly bad, and there is a particularly unpleasant form with multiple episodes of vomiting, and the hydration status of the woman is very low. She's dry, but dehydrated, and she may require fluids through the veins with vitamins and injections to alleviate the vomiting. So their 1st child actually started preschool as well. And you know the British media is always happy to expose them. Staying in some interesting news items, exposure to organophosphate flame retardants. So some of the things that you can actually have at your home. So they looked at a recent study of women who went for fertility treatments, so in vitro fertilization. And some of the household items found in yoga mats, car seats, and clothes. So yoga mats, car seats, and clothes, some of those flame retardants were found to hamper fertility in those women. So something to remember, especially if you're trying to conceive. National Patriotism Month is the month of September locally, as we're going to be marking Republic Day on September the 24th. And it got a boost as we moved to some sport with a dramatic and sensational win by the Trinbago Knight Riders in the CPL T20 at the Brian Lara Cricket Academy over the weekend. So fantastic news, and congratulations to the Trinbago Knight Riders on a wonderful campaign in the regional T20 tournament. The West Indies also gave an improved performance in the Test series in England, and one can only hope for improved relations with the board and senior players for subsequent matches. As usual, we close this segment of Doctor in the House with a medicine corner. And we were talking about, and one of the themes on this show is healthy lifestyles. And we were talking about the burgeoning epidemic of obesity. And more than half of American adults are currently obese, or at some point have been struggling with the complications of obesity. Type 2 diabetes, high blood pressure, high cholesterol, gallstones, a fatty liver. cysts in the ovaries, arthritis, and an increased risk for a plethora of cancers, including of the womb, the colon, the breast, and prostate. And there is a conference on obesity that is carded on September 30th and October 1st from the Medical Association, the Trinidad and Tobago Medical Association, in conjunction with the University of the West Indies and the Caribbean Obesity Society. So I'd like to congratulate all of the members of the TTMA for the foresight in fighting obesity. And let food be thy medicine. So that's one of the aphorisms that we like to say here. In Denmark, women with polycystic ovaries, we know that that can be often driven by obesity, fat around the tummy. They may find that there's increased hair growth. There may be acne, problems with periods and infertility. But the risk for type 2 diabetes in women with polycystic ovaries in Denmark was quadrupled. It was 4 times more likely in persons who had polycystic ovaries, more so if they were struggling with their weight. And they were also more likely to be diagnosed at an earlier age. So we can't just say that persons are getting older now and that you would wait until your 40s or your 50s before you start screening for diabetes. Persons in that study were averaging 31 years old, and they were already type 2 diabetic. There was a recent heart conference in Spain, in Barcelona, and one of the talks and one of the lectures at that meeting actually advocated for population-wide screening, so screening the entire population for high blood pressure, looking for swellings to the arteries in the tummy, so your aneurysms, or looking for blockages in the arteries in your legs, because it appeared to be life-saving, it was feasible and cost-effective. And we know that last week too, there was a study with Southeast Asians, and many of the persons in the West Indies are of Southeast Asian origin, are at risk for type 2 diabetes, and early lifestyle interventions, so starting in childhood, starting below the age of 18 years, was best for reducing the chance for heart attack and stroke. So starting in childhood, that is going to be one of our thrusts, that while we're trying to fight the fat, we're going to try to find that in schools. That is one of the thrusts I know from the Diabetes Association in Trinidad and Tobago, and they're launching numerous projects in order to enhance the level of awareness at primary schools, primary and secondary schools. That European Heart meeting in Barcelona challenged wisdom too on some of the dietary aspects of life. So we know we've been talking about a healthy diet involving fruits and vegetables and low fat and low salt. But they've actually been saying, so there was a big study called a PURE study that sent out questionnaires to more than 18,000 persons in many countries. And they found that some of the diets rich in fats were not necessarily increasing your chance for death, but high carbohydrate diets certainly did. So the benefits of fruits and vegetables and legumes may be about 4 to 5 servings per day. The benefit was definite, but high carbohydrates, avoidance of that is what is recommended to cut your chance of having a heart attack and stroke. So go low carb, go low carb. That's one of the findings from that PURE study, was the term that was used. And similarly, a lifestyle study that was done in Japanese, the ethnic Chinese and Japanese, who substituted 1 serving of red meat or poultry with fish, reduced their chance for type 2 diabetes by 25%. So those are little bits of information, nuggets of information from some of the global medical news that I think we can incorporate into our lifestyle. Just cutting out your red meat or reducing your red meat and poultry intake and substituting for fish or shellfish may cut the type 2 diabetes risk by as high as 25%. That was seen in a Chinese study involving more than 45,000 adults. Right, so let's take a short break, and when we return, it'll be part of the open forum on Doctor in the House. Stay with us.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
I'm a cool kid, you're a cool kid, we are cool kids, are you a cool kid? Every day I want it, I need to drink lots of it, full of fruit, vitamin C, give me lots of it. My imagination is growing and so am I. I'm getting big, so give me fruit of cool kids, it's so juicy, so I could touch the sky.
Become a cool kid now by visiting www.fruitacoolkids.com.
Welcome back to Doctor in the House. And as we mentioned, there are so many tragic effects arising from the hurricanes that battered our neighbors in the Caribbean and across in Florida, with so many friends and relatives across there, struggling and quaking actually with the swirling flood waters. I know it left a trail of trail throughout places like Antigua, Barbuda, and St. Martin, and then through to Florida. With Hurricane Jose forming in the Atlantic, we would like you to be part of a hurricane relief fund for Antigua and Barbuda. There are collection centers. It's part of the IBN and the Adams Investments in Antigua. No cash, so we are looking for funds for donations of any kind: water, clothing, food items, baby food, diapers, and many sorts of clothing, I would expect, and pharmaceuticals over the counter. The collections have already begun, and from 9 a.m. to 6 p.m., feel free to call any one of the numbers on the screen. And so I'm sure the guys at IBN would be happy to assist as part of the relief for Antigua and Barbuda following Hurricane Irma. And as usual, and this part of the show, some birthday greetings are out for the month of September. Happy birthday, 9/11, for Cynthia Surat, a close friend from Pinal and a huge fan of the show. Birthday blessings to you, my lady. My cousin Ryan Ratton, he celebrates his tomorrow, September the 12th. God's blessings to you. And my brother Jerome is having his on the latter part of September, September the 30th, and I certainly wish you all the best. Ritesh Samaru, my good friend and neighbor, he had his birthday on the 10th of September. Happy birthday to one and all. Greetings to Sarah and Anna. So the Lalchan and Ali families, they had a lovely engagement a few weeks back. And special hello to both Sarah and Anna. And hello to a special lady, Selina Akbarali. Selina Akbarali, a special hello to her. She loves the show, and her family, she and her family are firm fans and viewers. They always they are always tuned not just to Doctor in the House, but to IBN. So I would also like to say a special greeting and good evening to the Kunjas as we remember the passing of one of our brothers, Hakim Kunja, who died 6 years ago on the 11th of September. And indeed, I know that you still grieve over him, Ma, and I know that as you say your prayers, you read your namaz, and you remain one of the embodiments of a good Muslim woman. We certainly remember Pa for being one of the kindest, loving, and gentlest guys that we knew. Birthday greetings to another one of my special friends and brothers from another mother, Mr. Gangadine, Donald Gangadine, and I wish you all the best too. And Miss Riva Caesar, who is also tuned in to Doctor in the House. So, and as usual, when it comes to some of the humorous aspects, it's the lighter side. After I spoke about some of the darker aspects of the news and medicine, the lighter side in this part, I would also too like to acknowledge the faithful members of the studio audience, Mr. Sat Budram and beloved Dr. Neela Ramdas Teelucksingh. Faithful fans, viewers, and members of the studio audience. Welcome to both of you all. Let's have a look. So it's a clip from a British film, That Mitchell and Webb Look, so is the name of it. And we know that I always slam the charlatans and the modern snake oil vendors that like to peddle their wares, that all these unproven cures to treat anything from diabetes to cancer to HIV. And so it's a problem across in the United States, across in England, and they have created a mock version of an accident and emergency called homeopathic A&E. Let's have a look.
What have we got?
RTA, broken arm, suspected internal injuries, severe contusions to the head.
Okay, needs to move fast. Put me a solution of arnica montana, stat.
Strength?
1 part in a million.
I'm sure, it looks serious.
You're right. We need to strengthen the dose. 1 part in 10 million.
On it, doctor.
Here you've got a tricky one.
Nothing we can't handle. Get me some wolfsbane, also known as monk's hood, in here. And a whole tray of flower remedies.
Whoa, your chakras are fading. You need some crystals.
Nurse, fetch me some purple tinted quartz. Damn it, you're right. Make that aquamarine quartz.
Good call.
Okay, he's stabilizing. Now, does anybody know what sort of car hit him?
Blue Ford Mondeo, apparently.
Right, get me a bit of Blue Ford Mondeo, put it in water, shake it, dilute it, shake it again, dilute it again, do some more shaking, dilute it some more, and then put 3 drops on his tongue. If that doesn't cure him, I don't know what will.
I think you should have a look at this, Simon.
What is it?
Dear, this poor chap's got long to live.
Why not?
His lifeline, very short. But his horoscope's not too clever either. Sagittarius. Brace yourself for a surprise. Things are about to change for you.
Certainly are, unless... Wait.
What?
We could try drawing a bit more lifeline on with biro.
It wouldn't work.
You got a better idea? Let's see what happens. Time of death, 3:34. Ish.
Tough day, eh?
I just can't stand losing them.
It happens.
I don't know. Sometimes I think a trace solution of deadly nightshade or a statistically negligible quantity of arsenic just isn't enough.
That's crazy talk, Simon. Okay, so you kill the odd patient with cancer or heart disease, or bronchitis, flu, chickenpox, or measles. But when someone comes in with a vague sense of unease, or a touch of the nerves, or even just more money than sense, you'll be there for them. Bottle of basically just water in one hand, and a huge invoice in the other.
I suppose you're right.
Now, another drink.
I need one.
Excuse me. 2 more homeopathic lagers, please.
Whoa, that's strong stuff.
More money than sense. And I know that some of the trainees who love their homeopathic remedies, and they would rather just recently I was speaking to one of my close friends, Dr. Vinod Mahabir from the East, one of the legendary doctors in primary care in the East, in Aruka. And we were saying that if more persons used to listen to conventional doctors, used to see their pharmacists and take their medications, we might certainly find that there would be a reduction in admissions to the accident and emergency. So it's just a reminder that many of these so-called treatments which are touted are not proven, they're not evidence-based, and they're purely to get your money. Right, so let's take a short break, and when we return, the phone lines will be open for the open forum of Doctor in the House. Don't go anywhere.
For the everyday lowest prices on all grocery items, trust low-cost supermarket for the widest variety of quality products at low prices. Freshly picked fruits and vegetables, healthy products for your well-being, high-quality meat cuts, and a warm and friendly service. Low-cost supermarket, Southern Main Road, Cunupia.
At times I feel that the sun is hidden by a hazy sky.
A God's gift brought straight from the farm to your plate. Jazza Rice, with its premium range of basmati rice, helping you prepare your perfect, mouth-watering dishes just as you planned. Jazza Rice, blessings in each plate.
Every now and then we need.
This is a Pakistani product, and all over the world, at least try it once. And if it's good, please let us know. We need your encouragement.
Just a little time to breathe.
Remember the good old days when we had roti with rich, creamy butter? Eh? Hey, give them a roti. Greenfields butter, available nationwide.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
Welcome back to Doctor in the House. So the phone lines are open. The phone lines are now available, but they're open, and the numbers should be on your screen shortly. We'd love to hear from you. Just a reminder that when you're patched into the studio, to listen on the telephone and mute the television set so that the feedback wouldn't affect your reception. So in the meantime, while we're waiting on the first caller, so the numbers are on the screen now I'm seeing, while we're waiting on the first call, it's just a reminder about the dangers of the rainy season with dengue and leptospirosis. One must be vigilant. And leptospirosis right now at San Fernando Hospital, I know that we've been admitting patients who have been warded with problems with their kidneys and trouble affecting the liver, with issues affecting the liver. So it's an infection from rat and dog urine. And that tends to be exacerbated during the rainy season. So we know about dengue, but leptospirosis can often have fatal or catastrophic consequences if you acquire that particular germ, that particular organism. And one of the themes, as we always say, is healthy lifestyles and fighting the global epidemic of obesity, the role of diet and exercise. I know that I emphasized it during the program, but I can't emphasize it enough, because we're battling not just with obesity, we're battling with type 2 diabetes, the leading cause of blindness among working-aged adults. It's the leading cause of end-stage kidney failure. It's the #1 reason for non-traumatic loss of limbs. You're 2 to 4 times more likely to have a heart attack and stroke if you're a diabetic. And we know that that too is a global problem. So in fact, it's a twin epidemic with obesity. One of the analogies I always say is that you're thinking about obesity as a driver, looks in the rearview mirror and you're seeing type 2 diabetes, you're seeing hypertension, problems with lipids, and in the back seat, that exploding so-called metabolic syndrome. Right, so let's go to the phone lines, and we move to Central Trinidad. Good evening and welcome to Doctor in the House. You're on the air. Hello? Hello?
Hello?
Good evening, ma'am. Thank you for joining us.
Hello, doctor?
Hello, yes.
Good
You're on the air.
evening. Welcome back.
Thank you very much, ma'am. It's a delight to be back.
Yes,
welcome to the show.
We missed you.
Thank you.
I would like to find out what is a leaky gut,
right,
and how does it affect the body?
Okay, thank you very much for that.
I'll listen offline.
Thank you. And once more, so we're going to deal with some of the medical issues, any of the burning topics. Sometimes persons may be seeing their doctors and they're not too comfortable to chat about it. Now that leaky gut, sometimes persons may find that they have a misuse with bowel actions, and it may manifest itself in terms of a diarrhea. There may be a change in your bowel habit, and it's thought that it may be linked with stress, sometimes changes in bacteria. So in terms of the amount of bacteria, the type of bacteria that may be found within your gut, it's often important to see a gastroenterologist. So that's a specialist who might want to do a test on the bowel or the large intestine called a colonoscopy. Because although you may want to attribute it to just being stress or food or antibiotics or medications that may actually be affecting your bowel action, the gastroenterologist may want to ensure that there is nothing else. There may be certain blood investigations too. You may want to send you for a stool test, but so in fact it's recommended, I should say, so as a broad brush, that persons over the age of 50 should consider doing that test on the intestine called a colonoscopy. So it's something to consider from the time you're 50, particularly if you have a family history of colon cancer. So that's a good question. Since it's one of the things that we're seeing, perhaps it's representing one of the hidden epidemics of our times, one of the modern epidemics, this leaky gut syndrome that so many of our patients are experiencing. But just a reminder that it's important. It may be difficult to manage, but it would be important, I would say, to exclude the other reasons for a change in your bowel action. So you would want to ensure that you've actually had a chat with your primary care doctor or made a visit to a gastroenterologist. That's a specialist in problems from the mouth right down to the intestine. We go across to the east, and this time to Eldo is on the line. Hello, good evening, and welcome to the show. Hello?
Hello?
Hello, thank you for joining us, sir. Welcome.
Okay, good night, Doc. Yes. I did a C test recently, and the result was 5.7. Could you tell me a little more about that? And also, I did a full lipid.
Right.
Everything was good, excepting my good cholesterol was low. Could you give me some information on that, please? Thank you.
Thank you very much, sir. So, quite concise and crisp. The hemoglobin A1C is one of the blood tests used to measure the glucose levels, well, it gives you a snapshot on how your glucose levels are for the preceding 3 months, the hemoglobin A1C. So it's used, it can be used to monitor somebody who is a diabetic, a person who is a diabetic, or it can sometimes be used as a diagnostic tool. Now, if you're exceeding 6.5%, so it's expressed as a percentage, and if the hemoglobin A1C exceeds 6.5, it's thought that that person may well be diabetic, and you may want to follow it up with a repeat test. So, of course, we have a lot of issues with labs locally in terms of standardization, or maybe another way to diagnose diabetes. 5.7 to 6.4 is viewed as pre-diabetic. So it's almost as if you're standing on a threshold of becoming a full-blown type 2 diabetic. So it's a warning, it's a red flag that you have to be careful, that one must be vigilant and embark on diet and exercise changes in order to prevent the rise in your blood sugar level. So 5.7 to 6.4% is pre-diabetic, and under 5.7 would represent a normal level. So in fact, a lot of diabetes doctors would probably say that a good range may be 5 to 5.4%. And so a lot of individuals may find that this rising fat around the tummy that I mentioned, that's not just a storage depot, that's angry, exploding fat. It produces a lot of substances and hormones in the body that can affect things like the cholesterol level. Now, your lipid profile, you mentioned that a good type of the cholesterol or high density lipoprotein was low, and that can be a risk factor for heart attack and stroke. So it's a risk factor for cardiovascular events. So ways at which that you may want to address it may include exercise, something simple like exercise, chatting with your doctor, because sometimes it may be genetic, a lot of these things. Some of the medications that we used to use, or some of the newer ones which are on the market to raise the good type of the cholesterol, unfortunately, many of the studies that were done abroad in the United States and Europe have not borne fruit. We haven't seen that medications that boost the good type of the cholesterol would improve someone's mortality, would lower the chance for death, unfortunately. So that's one of the negative aspects in many of the trials. But certainly exercise and trying to maintain a healthy weight and a healthy lifestyle that I enunciated earlier in the news would all be parts of your management. But two great questions so far, and we stay in the East. This time we move to Malabar. Good evening, you're on the air. Thank you for joining us. Hello? Hello?
Hello?
Good evening, ma'am. You're on the air. Welcome to Doctor in the House.
Pleasant evening, Doctor.
Thank you, ma'am.
It's so nice to see you back.
Thank you. Thank you. It's a pleasure.
Okay. My problem is the doctor said I have osteoarthritis.
Oh, dear.
And they find that the hip bone is damaged on the right, and the whole foot is swollen.
Oh, no.
And when I keep rubbing it, sometimes I have to keep up the foot with the go down.
Yes.
Also, my hands, I have a lot of pain in my two hands. Whenever I want to urinate, well, the pain just starts to get worse. After urinate, the pain gone.
Okay.
But both hands is just pain right through. Sometimes I could pick up something, and the next time I can't. But I'd really like to deal here what I can do for the hands. The pain in both hands.
Thank you very much for that very relevant and topical problem, because a lot of persons find themselves riddled with the pain associated with arthritis, not just pain, but sometimes swelling, stiffness, but there may be changes in the structure or deformities as a result of arthritis. So the word arthritis means that the joint is inflamed. You have the wear and tear of the joints or the osteoarthritis, but you may have a few other reasons for arthritis. One of the particularly unpleasant forms is rheumatoid arthritis, and that can sometimes affect hands. It can cause stiffness and your deformities of the joints. I would recommend maybe chatting with your doctor whether or not there may be an element of osteoarthritis which has affected your hip. But whether or not there may be another form of arthritis too that may be diagnosable by a blood test or maybe an X-ray. Physiotherapy, certainly weight loss would help on the hip. But I certainly empathize, as you may find that many of these conservative measures are not alleviating your pain and your discomfort. And certainly the pain associated with any form of arthritis so affects one's quality of life. And many persons may find that they need certain stronger medications. But I would recommend first that you ensure it's not another form of arthritis. There may be some forms of relief, pain relief, and physiotherapy, so initially. So if your doctor, if you're struggling with your doctor at the primary care level, you may want to consider making a referral to one of the institutions to see an orthopedic doctor. So an orthopedics surgeon is a specialist in issues affecting the muscles, bones, and joints. But there is certainly a plethora of medications and many options available to manage osteoarthritis, but it remains devilishly tricky to treat. And I wish you all the best and God's blessings. Thank you. You sound like one of our regular fans from Malabar. And we stay in the East. It looks like we're getting quite a number of calls from that part of the country to Arima this time. Good evening and welcome to the show. Hello?
Yes, good evening.
Thank you for joining us, sir.
I went to get a procedure done a couple of weeks ago in San Grande Hospital.
Right.
And a needle was put in the back of my left hand to give me some sedatives.
Yes.
But the nurse, after the needle was put into the hand, the nurse connected, I would call it a plunger with water, and pressed that into the veins. So I asked what that is for. And I was told that if the needle is not into the vein, it will hurt it. Right? So I said, okay, the procedure was done.
Yes.
But up to now, I'm getting, I wouldn't say pain, but a tenderness in the left hand, the whole back of the hand. Yes. You know when you're wearing jeans and you try to put your hands into the pocket, I will feel it, I'll jump. Or when I'm washing my hands, the back of that hand is hurting from the wrist to the fingers, and it is swollen slightly. I want to know if that is a normal procedure. Thank you.
Thank you very much, sir. So some persons may find that if you're getting many form of sticks, if you're stuck with a needle or you're trying to put up fluids, if you're trying to put up drips, it may involve the entry of a needle and a plastic tubing, the cannula, is inserted into the vein. The needle is removed and that plastic or rubber tubing remains within the vein for the administration of medications and fluids. Sometimes some of the medications may affect the lining of veins. They may be stronger or harsher on the walls of veins, and they can actually damage those veins. Sometimes the wall of the veins may become inflamed, so it may cause some level of pain or discomfort, sometimes a bit of swelling or redness. So I would advise you that if you find that you're still having some uncertainty or you're not too happy with your hand following the procedure, it would be good to present to the Accident and Emergency at Sangre Grande Hospital, just so they would make sure that it's nothing like a brewing infection and rumbling infection, so any sort of irritation. So it may well have been maybe the contents of what was injected. Sometimes the procedure as well too can cause a bit of the discomfort. It doesn't sound like there's anything that would be potentially limb-threatening, but it would be good if you find that you're not satisfied with the way that your hand would have recovered following the procedure. It would make good sense to return to the casualty just to have a formal look by a physician. But just some of the complications, and that's why it's important that So apart from the use of IVs, apart from the use of the intravenous lines and so forth, it's important that care and good maintenance, especially for patients who are hospitalized, that is maintained. Right, we have another caller on the line. Hello and welcome to Doctor in the House. You're on the air. Hello?
Yes, sir. Good night.
Hello, thank you for joining us. Good evening.
Yes, sir. Hello?
Hello? You're on the air, but just a reminder, listen on your telephone. Listen on your telephone and not the television set. Listen on your telephone.
I am an angina heart patient, and I was very ill one night in June, and I went to the hospital.
Yes.
And the doctor there said I was having a mild heart attack. And some of the medicine that they gave me, amlopidine,
yes.
AMLOPIDIPINE, and Correg, making me very shaky.
Okay.
I would like to know if to continue to take it.
Right.
Like to know if to continue to take it.
Thank you very much for that call. Now, it's hard, and it's one of the things that we always say that it's a disclaimer of sorts on Doctor in the House that we're not attempting to diagnose. So if you noticed with some of the calls that we've actually been trying to guide you in the right direction to seek advice so that when you go to see a physician that you may have maybe a more reasonable clinical encounter. It's hard to tell whether you should stop some of those medications, especially if you're a heart patient. So for the rest of our viewers, so angina might be classically marked by pain in the chest. There may be central chest pain. So and it occurs due to blockages to the arteries involving the heart. And it can fall precariously short of inducing a heart attack. So some persons may get crippling chest pain at rest, and that can indicate forms of angina. You may have a more stable type when you walk around, and then it goes away when you rest yourself. Persons with angina may find that they take a tablet under their tongue, and it opens out the arteries so that they feel better. Sometimes a spray under the tongue or a patch might actually alleviate symptoms. But frequently they're on medications to manage the angina, ranging from drugs to lower the cholesterol to protect your heart. They may be on drugs like aspirin and certain medications for blood pressure or for diabetes, and some of the risk factors for heart disease would be appropriately treated and managed. So amlodipine is a drug which is used for high blood pressure. So amlodipine, and the other drug is carvedilol. The trade name, one of the brand names is Coreg. Both of those drugs may be frequently used in the management of heart patients in the management of angina. And so it's hard to tell if that may be the reason for your shakiness, because I would reckon that you may be on some other types. It would be useful, though, to seek advice from your doctor, whether it's from the emergency department in the East, or one of those emergency departments closest to you. So if you don't have a clinic visit at Mount Hope in the near future, and see if stopping or changing or maybe making slight amendments to the medications may actually improve your symptoms. Whether or not it's the medications responsible for that at all, so it's also a matter of opinion. So I wouldn't want to recommend that you change or stop any medications just quite yet. So I would say to talk with your doctor first, because the next thing you may find that stopping some of those drugs may actually exacerbate your angina, may make things worse. Right, so just a reminder that you're watching the call-in segment. It's the open forum of Doctor in the House, and we're streaming live on the IBN website, and we're also on YouTube, the YouTube site as well. You can search us on the IBN Master. Let's take another caller. Hello, good evening, and welcome to Doctor in the House.
Hi, good night, doctor.
Thank you for joining us, ma'am. You're on the air.
Okay, thank you. What I'm calling for the past couple of months, I've had a urinary tract infection, and I've been given a lot of antibiotics, including ciprofloxacin, doxycycline, plus intravenous drugs.
Right.
And still the urinary tract infection is present, and they gave me B-nanos now. And still, so I don't know what to do next. So, and it's there. So if you could please help me, I would greatly appreciate it.
Thank you very much, since that's also one of the commonest reasons for persons seeking care by primary care or even in a hospital environment, that urinary tract infections are especially seen in women. Persons may find as a result of the structure of the urogenital tract, the urinary and the genital tract. But you may find, too, that if your level of immunity is not strong, you may be prone to frequent or recurrent urinary tract infections. You may want to make sure that your sugar levels are normal, that you're not a diabetic, and you don't have some certain things which might be lowering your level of immunity. Frequent fluids, ensuring that you're well hydrated and that you're not holding your urine, may also alleviate the frequency or your symptoms. There is some limited evidence that things like cranberry juice may be beneficial, but maybe someone who over the last few months has been grappling with symptoms like burning, frequency of urination, blood in the urine, problems to pass, you may want to think about doing a scan of the urinary tract, perhaps an ultrasound scan or CT scan. Persons with stones, so you may not have the classic pain associated with stones in the kidneys, but they may be present and predisposing you to urinary tract infections. Stones, there may be abnormalities within the urinary tract. And if you're not having relief and your doctor has sent off urine samples, bearing in mind that you may have tried certain antibiotics like ciprofloxacin, but we're seeing a lot of growing resistance to these conventional antibiotics which are available over the counter. So germs are getting smarter, and unfortunately these antibiotics are not effective as they used to be. So some of the classic ones are no longer worthwhile, and they're no longer being as effective as they used to. So chat with your doctor about sending off a urine sample to the lab to test and see if it grows any microorganisms, if it grows any specific germs, and which antibiotics would be sensitive, which antibiotics would be useful to actually kill the bacteria causing the urinary tract infection. Think about scanning, think about stones in the kidneys, think about a lower level of immunity. And of course, if you find at a level of primary care or at the hospital that you're still having no relief to your symptoms, the specialist to think about is a urologist for frequent urinary tract infections. Right, but fantastic questions so far to start off our new season of the show. We go next to Central Trinidad, this time to Charlieville. Good evening and welcome to the show. Hello.
Hello, doctor.
Thank you for joining us, ma'am, and welcome.
Hi, this is Zalifa Ramjit.
Ah, welcome, welcome. One of the stalwarts, and I know that you're one of our fans. A special good evening to you and to your family.
Thank you, doctor. Welcome back.
Thank you. It's a pleasure. So it's a pleasure. I know that you always watch this show. You sit down with Justin and Annan and the whole crew. And please extend my best wishes to all.
Please hang up and try.
Thank you very much. So it's always a pleasure to get callers wanting to welcome us back on the show. And so as I said already, I'm so excited, and we have bumper programs in store for you for the rest of 2017. So if by chance that you miss the live episode on Monday nights, there's a rerun of this show on Saturday afternoons at 1 p.m. So if you want to tell any friends or relatives who are unable to wake up too late, feel free to do so. Let's go back to the phone lines. Good evening and welcome to Doctor in the House. You're on the air.
Hello, doctor. Good evening.
Thank you for joining us, sir.
Hello, good evening, good evening.
Good evening. You're on the air.
I am getting some cramps in the night in my legs.
Okay.
what would you recommend that I do?
Thank you very much. And that's a problem. That has been one of the issues, though, that I always find. I know I didn't get a chance really to have a chat about some of the medical issues, though, that you've been having. But apart from managing the cramps, I think the important thing is to find out the cause, to find out why you are having the cramps. Some persons, especially if they're diabetic, you may find that nerve issues or problems with the circulation may be manifested as cramping, sometimes a burning, pins and needles, sticking. You may find that those can affect sleep and even affecting the quality of life because they're so common. Some persons always think that, okay, these spasms, these muscular spasms that manifest as cramps may be due to a lack of salt. But I can say from the outset that that's almost never the cause, especially if you're resting and so on. You may find, unless you've lost a lot of fluid or you're depleted, if you've lost a lot of salt, you've run a marathon or race, you may find that you're getting cramps. But if you're diabetic or if you have issues affecting the nerves or muscles, you may find that cramping may be a symptom. Sometimes if the thyroid is underactive, if you have a low level of some vitamins, like vitamin D, persons find that they get cramps or weakness in the muscles and pain and stiffness. And so occasionally medications. Some of the medications in the armamentarium, we were talking about not stopping medications too until you chat with your physician, but some medications have been found to be associated with cramping, particularly that statin-type drugs in certain persons. Statins used to manage high cholesterol. Some individuals may find that it may predispose them to cramps. So it'd be something to chat with your doctor, to sit down and see what's the cause. So getting to the root cause of the problem, so is actually the first stage in management. And then there may be medications that may be used, perhaps so if it's an issue affecting nerves, an issue with circulation, sometimes he may want to send you for some blood investigations to exclude medical causes for the cramping. But what a good question that was. And we go back to the east, this time to Trin City. Good evening and welcome to the show. Hello.
Hi, good night.
Thank you for joining us, ma'am, and welcome to you.
Okay.
You're on the air.
Yes, earlier on in the year, I started to experience numbness on the side of my face.
Oh boy.
Right? And I went to my neurologist, and I did several blood works and MRIs and various other tests, and everything came up normal. They say nothing is wrong with the brain, and the blood works came back normal as well, but I am still experiencing numbness. And so my doctor put me on Xanax and Tegretol.
Yes.
But what is happening now is that I have a swelling around my eyes.
Yes.
And at the side of my nose where my sinus cavities are. And if I don't take the Xanax or the Tegretol, I have this persistent numbness. So I'll listen to you off the air when you give the response. Thank you.
Thank you for taking the time to call in and share that worrying symptom, numbness to one part of the face. And it sounds like you've started your investigations beautifully. So in terms of doing an MRI and doing certain tests, just making sure that there's nothing structural affecting the brain. Because sometimes when you have numbness to one part of the face, it might include an issue with a nerve. So it's a symptom involving a nerve across the face. Drugs like Tegretol, and the other name for that is carbamazepine. So it's a long name. It's available on CDAP, and that can actually alleviate trouble affecting the nerve. It may represent some form of neuralgia, but very often it's painful when that happens. Things like Xanax for anxiety, it may help. It may help as well with some of the neurological issues. But there are certain medical problems that can be sought after. There are certain blood tests. I don't know if he's looked at some of the vitamins. I would expect that. Some of the vitamins, some of the autoimmune issues. Those are things in which you're making antibodies which might be attacking nerve endings. Sometimes those can be missed so on an initial encounter. So you'd want to look through with certain blood tests and make sure that you've covered all your bases. So occasionally, although MRIs are normal, it does not exclude issues with tiny nerve endings that can be creating symptoms. It's challenging. It's one of the difficult things to treat, similar to things like cramps and some of the problems that we've been hearing about so far on the show. But I wish you all the best. It sounds like you've started some appropriate medications. I wish you all the best, at least in some sort of ease to your symptoms. Right, we have a caller to the Sister Isle. Tobago is on the line. Good evening and welcome.
Hi, good afternoon, Doc.
What a pleasure to have you on the air. Welcome to Doctor in the House, sir.
Yes, Doc. What is happening is that I did surgery in 2014 for diverticulitis.
Okay.
I removed the descending colon.
Right.
But since after to now, I'm receiving a lot of pain.
Oh, dear.
I did several CT scans with contrast.
Right.
It says that I have other polyps. I still have other polyps in the intestine, in the large intestine. And what is happening is that I did a colonoscopy again.
Right.
The colonoscopy came back negative.
Great.
Right. But then I'm receiving a lot of pains. Right. A lot of pains. Excruciating pains at times, right? And it seems that the doctors don't know what it is, because everything I do come back negative, but besides knowing that I have other polyps in the intestine.
Yes. Thank you very much for that call from Tobago. And what we do know is that a lot of persons after surgery, so especially if they've had abdominal surgery, may frequently find they have pain afterwards, whether that's linked with scarring or whether some of the nerve issues, as our preceding caller was speaking about the numbness to her face, that you found that sometimes nerves, there may be muscles, there may be some element of healing that's still ongoing. There are some individuals who actually get a chronic sort of pain around that area, the lower part of the pelvis, that may not even be associated with the diverticular. So those are little swellings that may be found on the surface of the intestine and may cause bleeding or infection. It's good that you've had your colonoscopies. It's good that the CT scans have not revealed anything that might be potentially life-threatening. But I rather think that there may be scarring, there may be some issues involving nerves, and sometimes there are treatments. There may be treatments available to alleviate that pain, especially if you're having a level of discomfort affecting sleep, so affecting your bowel actions. They may or may not be associated with your bowel actions. Chatting with a surgeon or a gastroenterologist once more, so somebody who has specialized in the disorders of the intestine, the disorders of the colon might be your next step. But trying a medication out for things that, like chronic pain syndrome, certain persons who are having chronic episodes of pain and you're unable to find a cause, it doesn't mean that it's in your head. It doesn't mean that at all. It just means that the doctors haven't been able to pinpoint the reason for that. They haven't been able to properly elucidate what's the cause. And at least the scans have been reassuring. The colonoscopy likewise excluded any sort of nasty growth or lesion in the intestine, so at least that can put your mind at rest. But in order to manage that pain, that chronic long-standing pain, you may need certain medications that might alleviate nerve endings found in that area. Great question, and we go over to Santa Cruz next. Good evening and welcome to Doctor in the House. Hello? Hello?
Good night, Doctor.
Thank you for joining us. Welcome.
Good night, Doctor.
Good evening.
Hello?
Hello, you're on the air. Thank you for joining us, sir.
Yes.
It's a pleasure to have you on the show. The floor is yours.
Yes.
Listen on the telephone. Listen on the telephone.
Thank you.
Yes.
Actually, let's low down the answer. Yeah. Low down. Actually, low down there. Yes, sir.
Yes, sir.
Hello?
Yes, sir.
Yeah.
You're on the air. Go right ahead.
Yes, doctor. I am a patient from the hospital, the medical clinic. I suffer with high blood pressure, very, very bad. I am on a lot of medication, Some of them I will name for you. Endocrinology.
Yes, enalapril.
I also suffer with a fistula on epilem. I'm on Coral.
Right.
I'm on Aldomet. I'm on
quite a few medications.
But
right.
The problem is that I get a itching on the little foot.
Right.
And a chicken line. And some days I feel very good. And some days I feel like today. Like people will pass away.
Right.
Yeah. And sometimes I feel the stomach, the heart beating, the pulse beating fast. And I also get a fast beating by my temper, especially like when I talk to people and things, you know, I get that feeling, and it's like I will fall down.
Okay.
Yeah, I was on nifedipine. The doctor kicked me off from that because he see it wasn't working.
I thought that was okay.
Yeah. And I'm also on aldactone.
So aldactone, right. Another drug for high blood pressure.
For high blood pressure too.
Okay.
All these drugs, and yet the pressure is very high, very, very high.
Yes.
Yeah. So I don't know what you could help me to do with.
Thank you very much for taking the time to call in. And so if I could just take this call from next door, from San Juan, and we will get back to that gentleman's concerns. Good evening. San Juan is on the line. Hello. You're on the air.
Yes, Doc. Good evening.
Thank you for joining us, sir.
Yes, you're welcome. I'm calling to ask you, right?
Yes.
It just come off and on.
Right.
And my heart on right underneath. It just feel like it's hurting and like, you know, when I get cramp.
Yes.
Right. It just feel like it's cramping and all my ribs and things. I just get that same feeling.
Right.
I don't know if it's a heart problem or not. I don't know.
Okay. Well, certainly it's worrying if you're getting cramping at the chest area, cramping, pain in the chest. So especially if it's associated with radiation to the neck or the left arm, nausea, vomiting, sweating, the heart is racing if you're short of breath, those may be classic symptoms of a heart problem. Now, some persons, especially if you're older, you're diabetic, women, may find that they don't have that classic textbook sort of idea when it comes to chest pain. But if you're getting a cramping pain, it doesn't necessarily mean that it's a problem with the heart, but it's worthwhile to exclude life-threatening issues with the heart and lungs. Sometimes it may be muscular. So in origin, if you're young and you don't have any risk factors for having heart trouble, you may find that chatting with your doctor, he or she may recommend muscle relaxants or something simple like that, some sort of anti-inflammatory for musculoskeletal chest pain, for muscular type chest pain. Sometimes it may be issues with the stomach, and the symptoms may be alleviated with medications to reduce the production of acid. So occasionally anxiety and stress has been associated with some of those symptoms, such as a cramping sort of chest pain. What I would advise do is that at a bare minimum, that you go to chat with your doctor, have a look at some of the risk factors. So maybe it might be time to do blood tests to look at your sugar. Maybe it's time to check your blood pressure. It's time to catch up on how your cholesterol is reading. It's time to see whether or not it's safe to embark on an exercise program. Your doctor may want to do an ECG, which involves stickers on the chest, the arms and legs to look at electricity. He may want to send you for a stress test where you're walking on a treadmill while he's looking at electricity in the heart, or he may want to do an ultrasound of the heart, an echocardiogram. So a host of investigations that may be relevant just to see what is the cause for this sort of worrying symptom. So I would advise that that would be the pathway that we would normally investigate someone presenting with chest pain or cramping within the chest area. That's a great call and such a common symptom. But a gentleman from Santa Cruz, who is a member of the medical clinic, is grappling with what we call resistant hypertension. His blood pressure's still elevated despite him being on 3 or 4 antihypertensive drugs. So he called out a few classes of medications which are used to manage high blood pressure. And we're aiming for most of the population to keep one's blood pressure maybe under 140/90. Blood pressure is the force of the blood against the walls of heart and arteries. And you're trying to keep the top number, the systolic, under 140 and the diastolic under 90. That may be variable in certain persons, but in general, for persons under the age of 60, that's the sort of target that we're looking at, because you want to lower your chance for heart attacks, for strokes, blockages to the arteries and the legs, damage to the eyes and to the kidneys, and heart failure as well, in which you get fluid in the lungs and legs. So he's struggling with it, despite him being on many conventional drugs. He's struggling with his blood pressure. And maybe the doctor may want to think about whether he has an underlying cause to high blood pressure. Resistant hypertension may have a secondary cause. Sometimes we look back at people and we say, oh, it just runs in your family. You have primary hypertension, or essential hypertension is another term, which 90 to 95% of persons probably do. But there is a minority of persons, a minority of patients who may have a secondary underlying cause. Maybe it's an issue with the hormones. Maybe the thyroids are hyperactive. There's a little gland above the kidneys, the adrenal gland, that can sometimes get growths that release adrenaline. And that can cause a fast heartbeat. He mentioned things like that. A fast heartbeat can cause headaches and sweating, anxiety, a feeling of impending doom, and it can cause spikes and surges in blood pressure. So there may be hormonal changes, there may be issues with blood flow to the kidneys. You may want to ensure that the kidneys are functioning well too, and that may involve doing scans, and of course with religious adherence to diet and exercise, to lifestyle changes. He's also an epileptic, and that can also present challenges, I know, in terms of his management, in terms of adherence to certain medications. But resistant hypertension means that the doctor needs to be looking for secondary causes. He or she needs to be sending for different tests to see whether there is something underlying that is driving up the blood pressure. The fast heartbeat and the pulsing that he's feeling in his head may be sometimes things that he may want to look further. The heart as well too, you may want to look at the rhythm of the heart. And we are seeing one of the complications of obesity too, and even in some persons who may have a widening in the diameter of their neck, is obstructive sleep apnea. That's a term in which you're not getting enough oxygen when you're sleeping. So it may be marked by snoring in the night and sleepiness during the day. Persons may be at an increased risk for rhythm abnormalities, for resistant high blood pressure that doesn't seem to be going down, obstructive sleep apnea, that may also require treatment. So there are many facets to his case. It's a complex clinical case, but certainly we wish him, and indeed all of the callers, God's blessings, and thank you for taking the time to call in on the show. And unfortunately, it looks like we are out of time for the program this evening. Parting is such sweet sorrow, But I'd like to close with an inspirational video. Before we do though, but just a reminder too that if you want to make many of your donations to the victims of Hurricane Irma, relief to Antigua and Barbuda, there are collection centers appearing on the screen along with telephone numbers. And we are not asking for cash. We're asking for basic amenities, food items and water, clothing, pharmaceuticals over the counter that would be useful to our Caribbean neighbors. Hurricane Relief Fund to the victims of Hurricane Irma in Antigua and Barbuda. Right, so we'd like to close the program with an inspirational video to set the tone for not just the start of the season, indeed the start of the month. Let's have a look from
เขาจะได้อะไรถ้าเขาทำแบบนี้ทุกวันเขาจะไม่ได้อะไรเลยไม่ได้รวยขึ้นไม่ได้ออกทีวีไม่มีใครรู้จักไม่ได้มีชื่อเสียงที่มากขึ้นเพราะสิ่งที่เขาได้คือได้แค่ความรู้สึกได้เห็นความสุขได้เข้าใจได้ความรักได้ในสิ่งที่เงินซื้อไม่ได้ได้โลกที่สวยงามกว่าเดิมในชีวิตคุณอะไรคือสิ่งที่คุณต้องการมากที่สุด
Just a heartwarming reminder about the spirit of love and giving to close this chapter of Doctor in the House. Thanks to our splendid callers and viewers, remarkable studio audience, brilliant crew here at IBN. Good night, God bless, and enjoy the week ahead. Thank you for joining us.